Yeah, do you have a student in mind that comes to mind that had some executive function problems with language?
Yes. So I had a student, a younger student. This is she was actually kindergarten. Um, she did not, she couldn't complete sentences. I know that sounds weird, but she'd actually had a lot of speech therapy. She'd had a lot of therapies prior to meeting me. And when I met her, she wasn't answering questions in the way that you would expect someone to answer questions who has been in therapy that long.
Can you give an example of what she
Yeah.
would do?
So
Yeah.
she would say, what your name? Like if you'd ask a question, she would just say, what your name? So her language, the area of language that would be affected was she was just getting stuck on the same word. So the same phrase, that's all she could come up with. If you ask her a question, she might, it's kind of like, I always like to say it's word retrieval. That's the biggest issue.
Yep.
So it would tap into what your name, and that's not really what she was wanting to say. Plus she knew receptively, I had tested her receptive language. She knew receptively what she understood. Her receptive language scores were equal to her age. So there wasn't a delay. It was expressive language that she was having the difficulty with. So, but I also saw in looking at her, there were things that she had difficulty with sequencing. She had difficulty with organizing. She had difficulty following certain steps. There were some pattern recognitions that she had difficulty with that led me on and then me connecting the fact that she'd had a mild concussion. It was definitely in the expressive prefrontal cortex, well, pretty much the frontal lobe. So I started looking and I was like, okay, and attention was 100% affected. So we worked with started working on the memory, started working on word retrieval. And within the time from, her brain did go through kind of a storming situation. So it was probably week 6 of 4 days a week for 1 hour of cognitive intervention that she started completing sentences. She no longer said, what your name? Matter of fact, I'll never forget the day because she looked at these shapes and she goes, that's not a circle, that's a hexagon.
Oh, wow. That's a drastic change.
Yeah, that's what I said.
Yeah.
So it was, once you started going through the executive function skills and working in that area, all of a sudden she didn't have word retrieval. She didn't have that struggle. You just basically, and her parent, again, she had gone through speech therapy. She'd gone through language therapy. That had not helped because it was kind of a traditional speech and language therapy where you just kind of build on at that age. This was actually going in, when I say going in, but working specifically in the area of the working memory, the executive function skills. So that's probably the best language piece that I have. Yeah. I did have someone who had, and this is something that happens, we didn't talk about, but after a concussion, you can get inflammation as a secondary. And so sometimes you can, I will see it looks like, and I can't see it, but it looks like an inflamed temporal lobe. So they're very sensitive to sounds. They have auditory discrimination issues. There's some areas of that red flag that hyper or inflamed temporal lobe. And when you calm that down, then you can start to also heal, because inflammation, like anything else, decreases blood flow and decreases that activity. So I do see that sometimes connected with that language as well.
Yeah, and commonly too, because the temporal and the hearing networks, they're tied to the pons as well. And with TBI, there's a rapid, well, not rapid, but diffuse disruption of brain networks. So the brain's recovering, but all these different connections are then being rewired. So what was normal is now no longer normal. So it's compensatory, which, your brain is trying to rebuild itself after injury, which makes sense. And it sounds like that student had a case of mild aphasia.
Definitely 100%. And it wasn't tracked back to, and so you're exactly right with the aphasia, and that's the protocol. They were doing more of an aphasic protocol, which I will have to say, I'm not sure why. I know there are people out there who do cognitive rehab for aphasia, but for some reason in younger kids, they tend to go more, take a different protocol, different treatment plan, and don't do as much cognitive work as I think should, because in her case, she'd had, and they were good therapists, they just were doing the wrong protocol.
And is there a reason why that happens?
I think, as speech language pathologists, we can be in a variety of settings. So if you're a speech pathologist and you went directly from grad school into the school system, then you kind of follow a different track that doesn't lend yourself to the cognitive aspect, and you don't really get that information of connecting two and two, putting two and two together. Then there are others who, just based on insurance, sometimes they'll have to be seen by an adult therapist versus a pediatric trained therapist. So really, it is important to find the person. I always tell any of my clients, I said, you have to find the one that works. You can give it a little bit of time, but if you're not seeing progress, change.
Yep.
Like find someone who knows it. And in this case, parents don't know this information. They don't really know what to look for. So you have to keep it simple and say, are they progressing? Are you seeing progress?
Yeah. And I think it's like really hard to ask, I guess the question that I have is, what does that progress look like? And how do you find that? Okay.
So if someone's doing cognitive, then there should be some data. Honestly, academic, they do data. Speech pathologists are trained to collect data with every session that they do. So there should be data tracking, which doesn't always mean anything to parents. Case in point, when I'm talking about the, if I'm doing working memory, all I have to rely on, because you're not going to see a change for a little bit of time, and you can't physically, tangibly see it. So you have to rely on the data. Is the data going up? Is there progress? If you're someone who's been in the field long enough, for me, I know the pattern of data. I know when it's working. I know when it's not. I know when to, accelerate, when to decelerate. So, you do kind of need to find a specialist who knows what that looks like and is versed in it. And it does take a little bit of, I've spent a lot of time training. So I'm not going to discount that, unfortunately, I'd like to say that everybody does that, but they don't. So it just happens to be a topic of passion for me. So I spent a lot of years training in that. But there are, I'm not unique in that. There are a lot of other really good therapists. So
I would disagree and say that you're quite unique, especially for the therapies that you provide. My last question for you, do you notice any difference in the parts of speech that someone with a brain injury versus a learning disability would struggle with? So for example, with that child that you described, it seemed like she had a problem with adverbs because the is was missing, but she connected the name, which is the noun, and she had the question, which is what, and the proposition, which is your. So is there a difference in maybe like parts of sentences that a person with a TBI versus learning disability might neglect or they might struggle with to speak or articulate?
That's funny that you actually asked that question, because it really connects my previous answer. So there are therapists who would, number one, you could also say mean length of utterance. Her mean length of utterance was less than what she should have had. Mm-hmm. You could definitely do a language analysis, which is what you're talking about, and looking into the specific parts of speech. But at the end of the day, that's why I think a lot of this is overlooked, because you dive deep into that. See, her parts of speech came back. All of that stuff came full, without working on the parts of speech and the details, because at the end of the day, it was the roots. So everything that you were talking about was more in the tree trunk of language, and that will come naturally because that's what the brain wants to do if the roots are secure. And that's why I heavily believe in the executive function skills and cognitive skills, because if you do not do that, then it's just a matter of the brain is constantly trying to survive and thrive, and it will just it will pick pieces and bits of the language apart, and it'll look different then. And you really will find yourself, the therapy, which is the same way that this child is, it didn't generalize. It never came to generalization, even though they work specifically on those mean length of utterance and parts of speech.
And another interesting thing with language is I worked with stroke patients for years. So the left hemisphere, you see all these differences in expressive aphasia and Wernicke's aphasia. But with the right hemisphere, you see that they don't understand idioms and expressions, cultural expressions. And often what happens is they shut down. Do you see that with students that have TBI, any hemispheric specialization?
Yes, you can see that even with idioms. You can see it with sometimes dyslexia has difficulty with idioms. You can have spectrum, like students who will, I've seen kids who actually have been diagnosed on the autism spectrum when in reality it was concussions. So depending on the concussion and where it happened, like for example, the one child who fell out of the bunk bed on the left side, he was 100% impacted in his temporal lobe area. But another child who, let's just say it was a car accident and you had a coup contra coup type of injury, would be global, more of a global span. And so you would see kind of pockets of that, which definitely could affect the right side if that was, more. And so that visual anomia, I mean, there's like all kinds of, it really, with concussions, varies so much on the type of injury, how it's sustained, just everything about that. And it does look like, I'm so grateful I had, my early days were spent in a rehab hospital, because I'm like you, the minute I see that, I'm like, oh my gosh, this goes back to, this person who, was in a car accident, this person who, had a gunshot wound, just different stuff. So it really, it's the brain is so magnificent and the brain is so diverse and everybody's unique.
Yep.
It just starts to take on its own little.
Yeah. And you really have to dig into that root system. But I'd also like to say the soil too, which is the actual physical brain. You have to see it to understand how the root system works and how they interact with each other.
And Dr. Amen of Amen Clinics, he does, so you have MRI and you have CT scans, but Dr. Amen does SPECT scans. And so he actually catches a lot of those mild, because he can look at the brain from just a different standpoint. So there are people out there who are doing that. It's for therapists like me, you can just, I feel like I can see it even though I'm not seeing it, because the characteristics are the same.
Yeah. No, and that imaging part, you have to see it.
Yeah.
Kyra, thank you so much. This is Kyra Minichan of the Cognitive Emporium. Kyra works with the smart but struggling student. If you think that your child may be suffering from a concussion or learning disability, please contact Kyra at www.thecognitivemporium.com. And Kyra, you also have a Facebook. You can also search for the Cognitive Emporium on Facebook as well.
Thank you.